Climate change is a phenomenon characterized by a long-term shift in weather patterns and global temperatures. Scientific evidence overwhelmingly supports the assertion that human activities, particularly the emission of greenhouse gases like carbon dioxide and methane, are the primary drivers of recent changes in the Earth's climate system. This narrative seeks to illuminate the profound and multifaceted impacts of climate change on human health, demonstrating the urgent need for comprehensive and coordinated action to mitigate these effects. The influence of climate change on health is pervasive, affecting a wide range of direct and indirect pathways. One of the most significant direct impacts is the increase in the frequency and severity of heat waves. Extreme heat poses a substantial risk to vulnerable populations, including the elderly, children, and those with pre-existing health conditions. Heat-related illnesses, such as heat exhaustion and heat stroke, can be fatal without prompt intervention. Additionally, higher temperatures can exacerbate chronic conditions, such as cardiovascular and respiratory diseases, leading to increased morbidity and mortality rates. Indirectly, climate change influences health through its effects on air quality, food and water security, and the spread of infectious diseases. Rising temperatures and altered precipitation patterns contribute to the proliferation of air pollutants, including ground-level ozone and particulate matter. These pollutants are known to aggravate respiratory conditions like asthma and chronic obstructive pulmonary disease, COPD. Moreover, climate change affects the prevalence and distribution of allergens, potentially intensifying allergic responses in susceptible individuals. Food and water security are also compromised by climate change, with significant implications for nutrition and health. Extreme weather events, such as droughts and floods, disrupt agricultural production, leading to food shortages and price volatility. Malnutrition, in turn, weakens immune systems and increases susceptibility to diseases. Water scarcity and contamination are exacerbated by changing precipitation patterns and increased evaporation rates, posing further risks to health. The transmission dynamics of infectious diseases are intricately linked to climatic factors. Vector-borne diseases such as malaria, dengue fever, and Lyme disease are particularly sensitive to changes in temperature and precipitation. Warmer climates and altered ecosystems facilitate the expansion of vector habitats, increasing the range and transmission of these diseases. Waterborne diseases, including cholera and leptospirosis, also become more prevalent under conditions of water scarcity and contamination. Beyond physical health, climate change exerts profound effects on mental health and well-being. The psychological stress associated with extreme weather events, displacement, and loss of livelihoods can lead to increased incidence of anxiety, depression, and post-traumatic stress disorder, PTSD. Vulnerable communities, particularly those in low- and middle-income countries, are disproportionately affected by these mental health challenges, compounding existing health inequalities. In response to these multifaceted health impacts, a comprehensive and coordinated approach is essential. Mitigation efforts, aimed at reducing greenhouse gas emissions, are critical to limiting the extent and severity of climate change. This includes transitioning to renewable energy sources, enhancing energy efficiency, and promoting sustainable land use practices. Adaptation strategies are equally important, involving measures to strengthen health systems, improve urban planning, and ensure access to clean water and nutritious food. Public health initiatives must prioritize the protection of vulnerable populations, incorporating climate resilience into healthcare infrastructure and services. Surveillance systems should be enhanced to monitor climate-sensitive diseases and respond rapidly to emerging health threats. Education and awareness campaigns play a crucial role in informing communities about the health risks associated with climate change and promoting behavior change to reduce these risks. International cooperation is imperative to address the global health impacts of climate change. Developed countries, which historically have contributed the most to greenhouse gas emissions, have a responsibility to support adaptation and mitigation efforts in developing nations. This includes providing financial resources, technology transfer, and capacity-building initiatives to strengthen health systems and resilience in vulnerable regions. In conclusion, the nexus between climate change and health underscores the urgency of addressing this global challenge. The health impacts of climate change are profound and far-reaching, necessitating immediate and sustained action across multiple sectors. By adopting a proactive and integrated approach, we can mitigate the health risks associated with climate change and ensure a healthier, more resilient future for all. This is not merely a call to action, but a call to protect and preserve the well-being of current and future generations. Thank you for joining us. If you enjoyed this video, subscribe and stay tuned for more.